Hi there. Today we will talk about person-centered care, what it is, and more specifically, the care environment. We will also look at challenges involved in the implementation of an appropriate care environment and innovations and initiatives aimed at providing a care environment conducive to facilitating person-centeredness in healthcare.
Person-centered care is a healthcare practice that, as the term suggests, puts the person receiving care at the center of the care being provided. This means the person's health choices are considered in collaboration with the healthcare team. This practice is built on the foundation of personhood, that a person is more than their illness, and therefore not only the physiological but the psychological and psychosocial status of the person are considered when providing holistic care. This holistic focus on healthcare is assisted by the belief that the person is the expert on themselves and therefore they are involved in their healthcare management. This is explained further within the care environment factors. While there are different definitions of person-centered care, Tracy Levitt-Jones, author and professor of nursing education, believes that each promotes self-determination and a commitment to helping individuals lead the life they want. Person-centered nurses are respectful, ethical, empathetic, non-judgmental, and self-aware. The person-centered framework, developed by Brendan McCormack and Tanya Mccance, is comprised of 4 interrelated domains, 3 of which, when applied in concert, aim to achieve the person-centered outcomes of the 4th domain.
The care environment consists of 7 factors that contribute to the whole domain. These factors include appropriate skill mix, a shared decision-making system, effective staff relationships, supportive organizational systems, power sharing, potential for innovation and risk-taking, and the physical environment. The 3 that we will discuss today include power sharing, shared decision-making, and effective staff relationships, which are all an integral part when it comes to receiving holistic, person-centered care, a feeling of well-being, and a healthy ward culture. Power sharing. This involves a strong team of staff from all levels of healthcare working together in unison for the common goal. Without a strong healthcare team and sharing of roles, the care and job satisfaction is at risk of diminishing. Staff members who felt more involved with their nurse manager or team leader were happier to promote the sharing of relevant information throughout their healthcare teams, which assisted with influencing a stable work environment. In turn, this began to reflect on their job satisfaction and how they cared for the patient. Shared decision-making systems. As nurses, we were often the ones that the patient looks to in regarding receiving medical information given by the specialist or the doctor. Nurses help to bridge the gap and simplify the information that is being shared. In the past, a paternalistic approach was the norm, but there is now more freedom for patients regarding their treatment choices, as well as better opportunities for them to express their self-determination, thoughts, and opinions. Involving the patient in shared decision-making for their healthcare means that the patient can leave the hospital having felt a sense of involvement in care that assists in building the person-centered experience. And effective staff relationships. As we have previously mentioned, staff relationships play a key role when we talk about person-centered care outcomes. They encourage a positive environment and work ethic through the healthcare setting to ensure that power sharing and decision-making come together to assist in providing a positive outcome for the patient and the staff. Without allied health members communicating and working together for the common goal, patient-centered care will be reflected in a poor manner and their health will be put at risk as they have not been put at the forefront of the team.
There are many challenges faced by leaders in the real world of nursing practice. Creating a positive environment and positive relationships between staff can be challenging for a leader. Leaders value and encourage opinion sharing, trust that staff members will deliver person-centered care, and encourages staff members to create positive professional relationships through effective communication. A leader encourages other healthcare members to express their opinions while showing that their opinions are valued. This builds effective staff relationships and motivates staff to create positive professional relationships with each other. This is achieved through communication and shared decision making, which are vital in preventing care environment challenges. This also ensures that optimum person centered care is delivered. Conversely, lacking of trust amongst nursing staff can present a challenge for the leader. This is because staff need to know they can trust one another's skills and their colleagues will provide effective person centered care through skills such as prioritization and time management. If effective trust is not developed between staff, it can undeniably cause adverse effect to the person's care. Secondly, heavy workload due to staff shortage, inappropriate skill mix, or limited resources also causes challenges or problem for a nurse leader in providing person-centered care. Due to the minimum number of staff and few resources, there is an increase in the number of managerial tasks which can lead to high stress and high pressure in leader. Leaders may feel pressured and burdened if they are not able to provide their team and patients with the appropriate equipment. Similarly, lack of support by the organization is another challenge which is faced by many nursing leaders. Nurse leaders are deprived of consistent training and career development programs which play a vital role in increasing effectiveness of person-centered care. Unsupportive organization can also cause workplace arguments, staff to become disinterested, and difficulty coordinating tasks and duties. An unsupportive workplace may also lead to violation of hospital policies and ultimate operational failures and poor treatment of patient. Lastly, nurses are encouraged to share the decision making with their colleagues, which may be challenging for leaders, as instead of giving orders and making decisions alone, they are required to consult with other health professionals and make mutual decisions focused on person centered care. During the sharing of opinions or ideas, it can be very challenging to come to mutual decisions if the team is lacking in respect and communication or has an ineffective leader to guide them.
Team nursing is a nursing style that was first introduced in 1953 at Columbia University in New York. It was pioneered by Eleanor Lambertson and her colleagues when the focus of nursing shifted from diagnosing and treating the illness or disease to diagnosing and treating the person as an individual. During the same period, there was an increase in people requiring hospital services and a lack of trained staff to provide these services. This also necessitated a new style of nursing. The definition for team nursing is comprehensive and holistic care provided by a group of nurses and other healthcare workers at all levels. This team communicate and cooperate, allowing them to function at high levels of efficiency and deliver a better standard of care as a collective. Without person-centered nursing, therapeutic relationships between patients and healthcare workers cease to exist. Even back in the 60s, it was established that therapeutic relationships are a necessary part of a person's care. Team nursing plays a key role in the person-centered care framework and the context in which care is given. It facilitates and encourages an appropriate skill mix of registered nurses, enrolled nurses, and assistants in nursing. It also promotes shared decision-making by involving the person and healthcare workers, and fortifies staff relationships by making communication a building block for team nursing. Team nursing also promotes power sharing between staff by having a new shift leader appointed every shift, and between patients and staff by involving the person in their care.
One innovation which has revolutionized dementia care and the environment in which it is delivered is Der Hoogevik, a nursing home in the Netherlands. This nursing home has taken changing the care environment to a drastic new level by establishing an entire town for people with dementia. Two core principles govern care in the village. Firstly, the provision of a familiar environment for the residents to commune with other people of similar background, values and interests. And secondly, to encourage residents to remain active and within a safe environment. All the homes are culturally or lifestyle based to suit those living within them, and accurately furnished dependent on the period when the residents' short-term memory function declined. Residents live and move through the town as one would in a normal community and attend to their usual daily tasks. Der Hoogevik has a myriad of the usual features of a village. There is a supermarket, theatre and restaurant, footpaths, gardens and park benches. There is also a doctor's clinic and even a pub. All staff, from professional care workers to baristas and shopkeepers, are trained to at least a minimum standard in dementia care. This kind of healthcare environment designs means there can be a relatively seamless transition into aged care, because the residents may continue to live and die in an environment suited to their own values and lifestyles. This puts the residents at the center of their care by providing freedom, respect and control. Since the opening of Der Hoogevik in 2009, The establishment of other similar concepts have emerged, such as a microtown built by New Direction Care in Belmay, Queensland, whose retail and health services can be accessed by residents as well as the wider community, and what will be Australia's first suburban village for dementia care, Corongi Village, to be built in Glenorchy, Tasmania by Glenview Community Services and HESTA.